It's Brain Health Awareness Week, and as we said before, our brains take in information and help us make sense of the world around us, but aging and lifestyle choices can affect our brain's health. Dr. Brent Wallis, Dr. B from People's Health, joins us to help you understand how both the brain works and the things you can do to have a healthy brain. Good morning, Dr. B. How are you?
Hey, Tommy, I'm doing great. Happy St. Patty's Day.
And the same to you, sir. You wearing green?
I am.
I think the only people that aren't are weather people on TV, because then they would blend into the map. How does growing older affect our brains?
Yeah, everybody knows what happens to your outside body when you're aging. You can develop wrinkles, you physically look older, but the same sort of process actually happens in your brain as well. And in particular, there are normally some age-related memory changes that happen to just about everybody, and they should be mild. They really shouldn't affect, your daily life, everything you do, but it's really normal for people to have trouble sometimes maybe recalling names or phone numbers of people that remembering birthdays. It can even be difficult sometimes to learn a new task or to do multiple tasks at one time. But research has really shown over and over that there are a lot of things you can do to train your brain to keep it sharp and kind of slow that aging process.
Well, what does that mean, train your brain?
Well, it's just kind of like a normal workout. What you do when you're working out is you're trying to increase your muscle strength and your coordination and improve blood flow to your heart and lungs and improve your physical stamina. And you can really develop a routine that does the same thing, that really strengthens and nourishes your brain and kind of gives it a workout. The brain is a fascinating organ. We use something called cognitive skills to really do the simplest task. Walking the dog, making dinner, things like that are all skills, and it's what the brain uses to learn and then store that information and then share that information and recall. So you use it to do everyday things, thinking, reading, remembering, and paying attention, which is really critical. So what happens with your brain is when you learn new things or you have a new experience, something you've never done before, your brain has to create new pathways, and those pathways communicate with different parts of the brain. And it's essentially like having a workout for your body. It's actually bulking up your brain, helping you to pay better attention, to do things more efficiently.
So what are some of the things you can do to keep your brain healthy?
Really, I tell people over and over, the most important thing you can do is challenge yourself. So when you become complacent and you sit around and you do the same things over and over, you really don't learn new things for really long stretches of time. Your brain actually slows down. There's really three key things you have to remember. You've got to work your memory. You've really got to do things repeatedly, and you have to learn new things. And there's a lot of different ways you can do that. Some people will read. Reading books is something very important, playing games or doing puzzles. But it's also good to try something brand new, learn a new language, learn how to play an instrument or take up a new hobby. I do a lot of home repairs, and you have to kind of figure out. I do.
Do you?
Figure out how I'm not going to destroy something that I'm trying to fix. That can be quite difficult, And socializing is really important, too. If you sit at home alone and you watch TV, you're really not using your brain very much. So you want to get out, you want to pick up the phone, call your friends. We have a lot of wellness events at People's Health, too. They allow people to socialize, really learn new topics, a lot of great seminars, and even music therapy and arts and crafts. Those can be really great exercises for your brain.
And that's at what, peopleshealth.com?
Yeah, you can go to peopleshealth.com/wellness, or you can visit us in our Medicare Center on Veterans.
One other thing, I guess, when you're doing that home repair, Doc, you're getting some physical exercise, and I guess that helps?
Yeah. Physical exercise is extremely important, and studies have shown over and over that people who exercise regularly can actually delay the onset of dementia or memory loss. It even decreases symptoms of depression. And remember, depression actually depresses your brain, and that can cause a lot of problems with your memory and problems thinking. But exercise is so critical because it increases energy and circulation, sends more oxygen to the brain. Something really simple like walking around the block, every day after work, or, getting up in the morning and trying to exercise a little. Something low impact is great. It improves your memory, the way you think, improves your ability to reason and actually learn and concentrate. And then to boot, it actually helps reduce your risk of other chronic diseases like stroke and heart disease as well.
It sounds simple, but sometimes you just got to take a walk and do some thinking, and it's basic stuff, but it really does make a difference. We're going to continue the conversation when we come back. We'll talk about sleep and how that affects the brain. It's Brain Awareness Health, and we're talking about it with Dr. B from People's Health, Dr. Brent Wallis. 8:20, time for traffic now on WWL. 8:25 WWL, I'm Tommy Tucker. It is Brain Health Awareness Week, and Dr. Brent Wallis from People's Health is with us, spending some time telling us how our brain works and some things we can do to maintain a healthy brain. Doc, I guess sleep is very important when it comes to that, huh?
Yeah, definitely. Sleep is really critical, for a lot of different reasons. When you're sleeping, that's kind of your body's opportunity to repair itself, to repair the cells, and kind of, wash away everything that happened during that day. And, we know very well that it protects us from, having difficulties with our chronic health problems. It can reduce rates of infection, but sleep really also helps to improve that brain function. And when you don't get enough sleep or you get broken sleep, everybody knows what happens. You decrease reflexes, you have trouble concentrating, and you can really be in a bad or a depressed mood. Chronic lack of sleep really can lead to depression.
What about some tips to maybe help you fall asleep or get better sleep, etc.?
Yeah, it's different for everybody. I tell people, especially at bedtime, you can try meditating. A lot of people read. You want to do something calm before you go to bed, not something super active because that's going to keep you awake. In particular, you got to think about screen time. A lot of people get into bed and watch TV or they play with their cell phones. And unfortunately, those devices give off blue light in particular that can confuse your body and make it think that it's earlier than it really is. And that's going to cause problems falling asleep. A little note I tell people with their cell phones, usually there's a setting where you can turn off the blue light at a certain time so it doesn't affect you as much later in the day. But what's really important is having a schedule. You want to try to go to bed at roughly the same time each night because that really helps your body regulate its internal clock. And probably everybody knows this week, after we had the time change last weekend, everybody probably felt a little slower, a little bit tougher to think because we threw off that internal clock. So you've got to try to reset and get back on a normal sleep schedule.
And that internal clock does work. And if you don't believe me, Doc, I'll call you at 3:30 on Saturday and Sunday morning when I wake up when I don't have to work. What about some foods that are good for brain health?
Yeah, definitely. So, we talk about food a lot because it's so important in keeping us healthy in so many different ways. But there are a lot of foods. We call them brain foods, and really they're the same ones that help your heart and your blood vessels, help people with diabetes. It's a lot of foods that contain omega-3 fatty acids, so that's a lot of the seafood that we eat, tuna, salmon, shellfish. This is a great time of year to get your omega-3s in, but also things that have vitamin B in them and folate. That would be things like lean meats and chicken. Fish also has that as well, but then some whole grains. And dark green vegetables are very, very good for you, as well as blueberries. Lots of fruits are actually very good for you as well. And then anything with antioxidants in it, so vegetable oils, whole grain foods, seeds and nuts, all of those things can actually be very beneficial to your brain as well.
Text cut pops up here, Doc. Is too much sleep just as bad as not enough sleep?
Not necessarily. What can happen with too much sleep is you may feel groggier in the morning, but typically the reason you're getting that extra amount of sleep is you may be waking up frequently in the night, and then you're sleeping later. So in general, too much sleep is not a problem. The only thing I do tell people, if you're sleeping all the time, talk to your doctor, because that is one of the signs of depression.
How we find out more about people's health?
Sure, you can always go to our website. We've got all this information and a lot more there at peopleshealth.com. And like I mentioned before, you can come visit us in our Medicare Center that's on Veterans Boulevard, right next to Party City at Causeway. We'd love to have you come in and join us in one of our seminars or our activities over there.
Appointments, but you can walk in as well. 800-978-9765. Thank you, Doctor. Excellent segment, and I learned something about making my brain healthy.
That's great. You have a great weekend, Tommy.
You too, so I'm just going to make sure I don't pull anything in the brain. I got to stretch it first.
Be careful.
You bet. I will. Follow People's Health on Facebook, Twitter, and Instagram. Right now, we pause for WWL First News, and for that, we go to Dave Cohen.